A cerebrovascular accident, commonly known as a stroke, is a medical emergency characterized by the sudden interruption of blood flow to the brain, leading to potential brain damage and long-term disability. The location of the stroke significantly influences the symptoms and complications experienced by the patient, highlighting the importance of rapid diagnosis and intervention to minimize neurological deficit. Strokes are primarily categorized into two main types: ischemic, caused by blockages in blood vessels, and hemorrhagic, resulting from bleeding in or around the brain. Ischemic strokes account for approximately 87% of all strokes and are often related to conditions such as atherosclerosis and atrial fibrillation. Hemorrhagic strokes, although less common, tend to have more severe outcomes and are often linked to high blood pressure or aneurysms. A stroke affecting the frontal lobe can lead to significant changes in motor skills and behavior. Symptoms may include weakness in the legs or arms on one side of the body, language difficulties such as Broca's aphasia, a condition characterized by choppy speech despite normal comprehension, and cognitive impairments. Individuals may also exhibit behavioral changes such as lack of motivation, irritability, and inappropriate social behavior due to the frontal lobe's role in regulating executive functions and social conduct. The blood supply to the frontal lobe primarily comes from the internal carotid artery and its branches, including the middle and anterior cerebral arteries. A stroke in the parietal lobe can result in sensory deficits, leading to difficulties in processing sensory information from the body, hemispatial neglect, where they become unaware of one side of their body or environment. It may impair spatial awareness and the ability to perform coordinated movements. Strokes in the temporal lobe can lead to a variety of symptoms, including difficulties with auditory processing and memory loss. This region is crucial for language comprehension and recognition of faces and objects, making it susceptible to causing aphasia and amnesia following a stroke. The occipital lobe is primarily responsible for processing visual information. A stroke here can lead to visual disturbances, including partial or complete vision loss in one or both eyes. Such strokes are relatively rare compared to those affecting other lobes due to the unique vascularization of the brain. Strokes that occur in the brainstem can affect vital functions, as this region controls many autonomic functions such as breathing and heart rate. Symptoms may include locked-in syndrome, which is characterized by complete paralysis, except for eye movement, as well as difficulties in balance and coordination due to its connection with the cerebellum. A stroke in the cerebellum often results in problems with coordination, balance, and fine motor skills. Patients may experience vertigo, ataxia, and difficulties with posture. The cerebellum's role in motor control means that any interruption in blood supply can significantly impact a person's ability to perform everyday tasks. The thalamus acts as a relay station for sensory and motor signals. A stroke in this area can lead to sensory loss, pain, and changes in consciousness. It may also result in severe emotional disturbances due to its involvement in regulating mood and cognition. Strokes affecting the basal ganglia can lead to movement disorders, including tremors and rigidity. This region is integral for coordinating movement and is often associated with conditions such as Parkinson's disease. Patients may experience visual hallucinations, particularly when the stroke impacts the areas responsible for visual processing. Lacunar stroke affects small, deep arteries within the brain, often in the basal ganglia, thalamus, or pons. Pure motor stroke, pure sensory stroke, ataxic hemiparesis, or mixed sensory motor stroke, depending on the specific area affected. Although rare, a stroke can affect the spinal cord, leading to loss of motor and sensory functions below the level of the injury. Symptoms include paralysis, loss of sensation, and autonomic dysfunction like bladder and bowel control.